Hi everyone, my name is Dr. Leah Walker, and today we are going to be bonding for SAP using the Pitts21 PRO brackets. So the first thing you're going to do is clean the teeth. We pumice and we etch, and I do train my assistants to etch at the approximate location of where we're going to be placing those brackets. So we're not etching the entire tooth. So you can see on those upper 2 to 2, she's putting the etch a little bit higher on the tooth because that's where the brackets are going to go. So I always start with my 6s and 7s first when bonding. I usually start with the lower left and then go to the upper left and then lower right and upper right. I will etch the teeth, use a self-etching primer plus Transbond. That seems to work for me. I know Tom uses Etch, Assure Plus, and Go-To composite. And then when he does his repos, he's using a self-etching primer, Assure Plus, and the Go-To. So when bonding the lower 6s and 7s, those are both at the same height at about 4 millimeters from the tube to the occlusal surface. And I sometimes cheat the lower 7s a little bit more gingival if I feel like they need to come up a little bit more. And I also cheat the lower 6s a little bit more distal, especially if they have that large distal cusp on those 6s, just to keep them in line. Now, when we go to the upper 6s, those will be at 4 millimeters as well, but the upper 7s, I'm measuring it at 2.5. So those are more occlusal than any of the other molars. And part of the reason is kind of want to get those lingual cusp out of the way because they usually interfere with the occlusion. So once we have the 6s and 7s bonded, we take that 4-inch cotton roll out from underneath the tongue and we put in our cheek retractors. So then we just have 5 to 5, top and bottom. Now I will start with the lower left, 5 go all the way around, and I'll do the 5, 4, 3, then I'll do the 2 to 2, and then the 5, 4, 3 on the other side. Now before we're bonding anything, you want to make sure you recontour those incisal edges and reshape those teeth for maximum aesthetics. When bonding, just a little tip, I actually have the girls use 2 bracket holders, and so they're giving me almost 2 at a time. So it just makes it go by pretty quickly. And then I'm, of course, measuring. So in this case, I'm measuring her lower 2 to 2 at approximately 4 millimeters. And that is from the slot to the incisal edge. And this is my assistant smashing the glue into the pad. You want to kind of butter it in there. And then we're going to the right side doing the 5, 4, 3. And you want the 5s to be probably around 5.5, and the 4s at 5, and then the lower 3s at 4.5. And again, measuring from the slot to the cusp tips. So now we're working on the upper, and those upper premolars, we want at least 5 millimeters on those upper premolars because that's what's going to control our transverse, our torque in the transverse dimension. We have the upper 5s at around 5, and then the upper 4s at 5.5. And then the upper 3s will probably measure 6.5. and the 2s at 6.5. Now in her case, the upper 3s are not completely erupted, so I'm not sure I'm going to be able to get that high on her, but what I'll do is I'll try to place the bracket as high as I can, and then when we put the wire in, we'll try to put the wire over the bracket to try to extrude it and then reposition it. So when we do bond though, and we're treatment planning, we're actually treatment planning that central first. So we want to know where we want to position that central initially. So for smile arc and for incisor display. So when bonding the upper ones, we want to kind of cheat the upper ones a little bit more mesial, and same with the laterals, but not as much. And the laterals, you want to create the mesial line angle needs to be parallel to the bracket pad. And then we'll start doing the upper left. And again, we're doing the 5s at 5, the 4s at 5.5, and then the upper 3s at 6.5. But again, for her, I couldn't get them that high because this is an adolescent. And adults, it's much easier. And so we'll just keep repositioning it until we get to the heights that we want. So there we have it. So once the braces are on, the next step would be to disarticulate. So what we want to do is we want to add buildups to her upper 4s. Now for deep bite cases, we want to add buildups to either the upper 4s or the upper 3s. If the upper 3s are fully erupted. Now in her case, they weren't, so we're adding the buildups to the upper 4s. So she's etching and priming and then adding the pillow to the occlusal surface. Now she's shaping it in a way that we want to create a ramp on the mesial surface of the pillow. And that way, when we open them up a little bit, that lower 4 is sliding right up that mesial ramp into a class 1 position. So in open bite cases, we're actually putting the buildups on the 6s and 7s and having them run squeeze exercises. And then for our deep bite mesiofacial patients, we are putting them on the upper 4s. Now she's checking the occlusion before she light cures. And so she's just reshaping it, making sure it's perfect before light curing it. Now that we have the pillows on, now it's time to put the wires in. And she closed the lower brackets to check the occlusion before she did the buildup, so she's having to open them back up. And when we do our 014 wire we start with, we actually don't engage the 7s. So I wait till the 1818 to actually engage the 7s. And the reason I do this is sometimes they end up falling out of those second molars pretty quickly, just because the 014 is such a flexible wire. So she's measuring it at this point, and she's measuring it probably around 6 millimeters beyond the molar tubes, because we're going to cinch the wires behind the first molars, top and bottom. You can see now she'll take the wire out and then she'll burn the ends to cinch it. And we do that because I just feel like that wire is so flexible that they could fall out of the molar tube, especially on the bottom because of people chewing. So she'll actually cinch the wire prior to engaging the brackets. And we use a little mathau and just try to grab it and rotate it towards the tooth. And then she's using a line guard to close all the gates. And then she'll go back through with her fingers just to make sure that the gates are completely closed. And there are stops on the wire, and you just want to make sure you place those stops mesial to all the crowding. And here we are with the upper. Again, she's going to measure and then cinch the back. And we just use a really, like I said, really small mathau. And she just grabs the distal portion of the wire and makes that 90-degree bend. So it's not poking the patient into the cheek. And then after she cinches, then she'll actually engage all the brackets. But we do kind of give the wire a little bit of freedom distal to that molar tube, just to allow for all of the alignment or for opening space for crowded teeth. And then again, she's closing with the Weingart and then going back through with her fingers just to make sure everything is nice and closed. There we go. SAP bonding. There's so much that goes into bracket placement that this will just give you a glimpse of how to do it. The best thing to do, honestly, is to sign up for a meeting, or even better, sign up for the masters. I guarantee you, you won't regret it.